Welcome to another super speedy summary. This is your host, Dr. Joshua Goldenberg. Today we're going to talk about a multimodal intervention using a combination of omega-3s, nutrition, exercise advice, and anti-inflammatory meds, NSAIDs, to help prevent cancer, cachexia, and other important outcomes for that. It's a very fascinating phase 2 trial that just came out the end of 2017. And here's the issue. Cachexia is unfortunately, very common in advanced cancer patients. Up to 80% of them will develop cancer cachexia during their illness. And cachexia has a negative impact both on the quality of life as well as survival rate. So if we can prevent it, we're doing good. We'll probably have better outcomes as far as cancer survival and quality of life. Now, we have some randomized controlled trial evidence that individual interventions may be helpful, but we have nothing that combines them all together. What would happen if we combine them in a single multimodal study to see if their effects were at the very least additive, if not synergistic? What did we find is we found that yes, a multimodal intervention for cachexia with a combination of omega-3s, that's 2 grams a day, plus nutrition guidance, exercise, that's both an hour a week of resistance training plus an hour a week of aerobic training, as well as an NSAID that's Celebrex in this case, do appear to be feasible, meaning that this study was designed to prove that it was feasible to do a larger study, which is now underway. But we had some very interesting findings. Not only was the study successful and they could recruit, etc., and the patients stayed and there was very little attrition, we actually saw an improvement in weight in this group. So very fascinating preliminary results, and we look forward to the results of the larger phase 3 trial that are already underway.